Hi, everyone. This is Janet Hill at the Rock Island County Health Department. It's 3:30 p.m. on October 13th. Thank you for joining us. Today we have with us Ed Rivers of the Scott County Health Department and Nita Ludwood of the Rock Island County Health Department. Ed, let's start with you with Scott County's numbers, please.
Today, the number of cases in Scott County is 3,636. And we're saddened to announce that in the past few days, we've been informed of the deaths of 3 more Scott County residents. This brings the number of deaths to 32. Our hearts go out to the families and friends of these latest victims of the coronavirus pandemic. As we've noted, deaths are a lagging indicator, occurring well after infection and development of the disease. Our case numbers in Scott County are rising at an alarming rate. The average age of the cases is also rising, indicating an increase of cases in the senior population. We have only more death to come unless our community adheres to the self-protective measures we've advocated time and again. When you protect yourself, you protect your loved ones. When you don't take these simple precautions we urge, you put them at risk. It's likely that younger individuals, including those with no symptoms, are transmitting the disease to older family members with underlying health conditions, resulting in these deaths. Please don't be the reason that your elderly family members contract COVID and pass away.
Nita, let's go with Rock Island County members, please. Nita, I think you're on mute.
So sorry. Today in Rock Island County, we are also reporting 3 deaths from COVID-19. A man in his 70s, a woman in her 80s, both who had been hospitalized, and a man in his 60s who was in a long-term care facility. In Rock Island County, our total deaths are now at 93. 32 new additional cases of COVID-19 are being reported today, which makes our new total 3,521 for Rock Island County. 20 patients are also currently hospitalized today in our county. And again, our deepest sympathies to the friends and family and loved ones of these most recent victims. Today marks 7 months since we first talked to you about a new virus spreading in our country and our community. Since that time, we have lived through a peak in April with the closure of businesses and restrictions on gatherings and deaths of members of our community, and a higher peak in July with over 4 times the cases, leading to higher hospitalization rates and an increase in deaths. Well, we are in that same situation again, and there's no end in sight. We have increasing community spread of the coronavirus here. The number of cases have equaled and surpassed the July peak. Friends are infecting friends, who then infect their family members. Individuals are being hospitalized, and some are dying as a result of that. Restaurants and businesses are closing due to the financial burden caused by this pandemic. Schools are balancing in-person instruction with the need to go online due to the number of isolations and quarantines of their students and staff. We all want this to end, but that requires us to act. We can do more, we can do better, and we must do it together. There are a variety of reasons why the coronavirus and COVID-19 have stopped our world in its tracks, like nothing most of us have never seen. The virus is new to humans, and none of us have developed a biological way to fight off the virus. Also, there is no cure, no treatment, and no vaccine at this time for this virus. An often overlooked reason about why the impact of this virus is so dramatic is the fact that we have benefited from the development of vaccines to protect against many of the diseases that used to run rampant in communities and cause high numbers of deaths. Smallpox has been eradicated globally. Polio has been eradicated in the US, and we have seen drastic reductions of measles, diphtheria, rubella, and pertussis, otherwise known as whooping cough, and other diseases. Thank you.
Most of us today have not seen the disastrous and often deadly effects of diseases that spread rapidly in a community. Prior to vaccines, diseases such as polio, measles, and smallpox spread quickly through a community, much as we're seeing with our current pandemic. Because we have not seen these effects firsthand, we do not have the lived experience to recognize the importance of stringently implementing the prevention measures public health is pleading with our community to take. We've become complacent because these diseases aren't rampant anymore. Without a point of reference, as a community, we have difficulty understanding the lasting impacts a virus such as COVID-19 can have on our family, neighbors, and economy. If we all had that experience, perhaps we would be more willing to handle things differently. We are now hindered by our own success in making once widespread deadly diseases a thing of the past. Where does this leave us? We're waiting for one of three things to happen. A mutation making this virus less infectious or severe, a vaccine or treatment, or herd immunity caused by 70% of the community having contracted the virus. Mutations can result in a more infectious and deadly virus as well. Many more will die before natural herd immunity is reached. The director of the World Health Organization calls this method immoral. Vaccines and treatment remain the most hopeful option, but their development is slow. We must continue to learn from the experience of the past and put all of our efforts into slowing the spread of this virus and protecting as many in our community as possible from contracting the illness. That means masking up, keeping our distance, staying home while we're being tested for COVID-19, and staying home when you're asked to quarantine or isolate. You might not get deathly ill. Your family member might not get deathly ill, but there are many in our community that cannot afford to fight this virus, including those with conditions such as cancer, lung disease, and heart issues. If you don't do it for yourself, do it for them. We're all in this together. Can we count on you?
Thank you, Ed and Nita. And we do have a couple of questions that have popped up prior, so we'll go ahead and go to those. And the first question is, due to numbers rising, should places start closing? Ed, do you want to start with that question?
Well, public gathering places are indeed areas where people contract the illness. We encourage all businesses to require masks in their facilities, businesses, bars, restaurants. If everybody masks in these locations, then transmission is lowered. We're seeing a lot of the cases that are happening in Scott County happening outside these public gathering places, in private parties, weddings, and other such venues. What we need is for people to understand that it transmits anywhere you go, and to take the precautions we've urged them to take everywhere they are.
A follow-up to that, should there be more restrictions? I know that's something that takes place at the state level. Do you have any thoughts on that you can share?
Could you ask that again, please?
Sorry about that. Should there be more restrictions? I know, in our circumstance that happens at the state level. Is there any thoughts you have on that?
Well, restrictions only work if people follow them. And if people follow them, transmission is lowered. So what we're asking you to do is to do it yourself. Don't wait on restrictions. Don't wait on the state to act. Do it yourself. We're all in this together. And if you don't do it, who will?
Nita, we have another question. What are the health departments looking at to help lower the numbers?
Sure. Well, we've been advocating the whole entire time for those 3 W's: to wear your face covering when you're out in public, watch your distance, keep at least 6 feet between yourself and others, and wash your hands frequently We'd also like to say to everyone this year in particular, make sure you get your flu shots. It's more important than ever. We know that you can have COVID-19 and influenza at the same time, and we certainly don't want that to happen. Both Ed and I have also signed a letter in coordination with our medical directors for the Chamber of Commerce to also advocate for businesses to make their own mask mandates in their individual businesses. In Illinois, of course, we have a mask mandate, but we really look to the businesses to help us enforce compliance with all of those.
Thank you. It doesn't look like we have any additional questions, so we'll go ahead and conclude for today. Some of the information that Anita just spoke about is available on the Together QC website, so you can visit that for more information there. Oh, I apologize. There is one more question that has come in. This is for Anita. Rock Island Milan schools are starting blended learning next week. Have you been working with the school districts to prepare? Any thoughts on how it will go?
Sure, we've been working with all the school districts in the county this whole entire time, and they all have really great plans. They have contingency plans, as we all know, and so we do expect there to be great compliance within the schools, and we hope that they will be able to do their blended learning and continue on, and everyone remains safe. In Illinois, the schools will also start getting some rapid care testing machines, so that will certainly help too. I don't believe any of them have received those yet, but they are on the way.
Ed, we can start with you for this next question. What would you say is the cause behind the uptick in cases?
As we've said, transmission is lowered when people mask up and pay attention to social distancing, wash their hands. The only thing that I can conclude is people aren't doing that. That's why we're beseeching you. Please mask up when you're with other people, stay 6 feet from others, and do everything you can to stem the transmission of this.
Okay, well, thank you, Ed and Nita, for again joining us with this important information. This recording will be posted on the Scott County Health Department's website. We will have a press release that follows this. And if you have any further questions, you can look to the recording. We do hope to talk with you again later this week. So thank you, everyone. Have a good afternoon.